Waking hallucinations, particularly hypnopompic hallucinations, are vivid sensory experiences that occur as a person transitions from sleep to wakefulness. These hallucinations can involve seeing, hearing, or feeling things that aren't really there. While they may be startling or unsettling, they are typically harmless and often linked to specific triggers. Below are some common causes of waking hallucinations. 1. Sleep deprivation. One of the most common causes of waking hallucinations is sleep deprivation. When a person doesn't get enough sleep or experiences poor quality sleep, the brain's transition between different sleep stages, especially REM, rapid eye movement, sleep, can become disrupted. This disruption may cause dreamlike imagery or sounds to spill over into wakefulness, leading to hallucinations. Prolonged sleep deprivation can make these experiences more frequent or intense. 2. Stress and anxiety. High levels of stress and anxiety can interfere with the normal sleep cycle, increasing the likelihood of experiencing waking hallucinations. Stress hormones like cortisol can affect how smoothly the brain moves between sleep and wakefulness, making it more prone to hypnopompic hallucinations. Anxiety, especially if it leads to restless or fragmented sleep, is a common trigger for these experiences. 3. Sleep disorders. Several sleep disorders are closely linked to waking hallucinations. Narcolepsy. People with narcolepsy often experience hypnopompic and hypnagogic hallucinations, which occur when falling asleep. Narcolepsy is a condition characterized by excessive daytime sleepiness and a tendency to fall asleep suddenly. Because their REM sleep patterns are disrupted, individuals with narcolepsy are more likely to experience vivid waking hallucinations. Sleep paralysis. During sleep paralysis, a person may wake up but be unable to move their body. This state often leads to waking hallucinations, as the mind is awake, but the body is still partially in the REM phase of sleep. The paralysis can make these hallucinations feel particularly terrifying, as the person feels trapped in their own body. 4. Substance use or withdrawal. Certain substances, including recreational drugs, alcohol, and even some prescription medications, can contribute to waking hallucinations. Stimulants, such as caffeine or amphetamines, may disrupt normal sleep patterns, increasing the likelihood of hallucinations upon waking. Conversely, withdrawal from substances like alcohol, sedatives, or antipsychotic medications can also trigger hallucinations during the sleep-wake transition. 5. Medications. Some medications, particularly those that affect the central nervous system, can cause waking hallucinations as a side effect. Antidepressants, antipsychotics, and sleep aids may alter how the brain transitions between sleep stages, leading to hallucinations. If you experience frequent hallucinations after starting a new medication, it's important to consult a doctor, as they may need to adjust the dosage or prescribe an alternative. 6. Irregular sleep schedules. People with irregular sleep schedules, such as shift workers or those with jet lag, may experience waking hallucinations more frequently. Disruptions to the natural sleep-wake cycle, known as the circadian rhythm, can make the brain more vulnerable to these experiences. Irregular sleep patterns can interfere with the natural progression of sleep stages, leading to disjointed awakenings where hallucinations are more likely to occur. 7. Neurological conditions. In some cases, waking hallucinations may be related to neurological conditions like Parkinson's disease, Alzheimer's disease, or epilepsy. These conditions can affect how the brain processes sensory information, potentially leading to hallucinations. People with these disorders may experience hallucinations at different times of the day, including upon waking, due to altered brain function. 8. Mental health conditions. While hypnopompic hallucinations are typically unrelated to serious mental health conditions, people with certain mental health disorders, such as schizophrenia, may experience waking hallucinations as part of their condition. However, in these cases, the hallucinations are more likely to occur at various points during the day, not just when waking up. 9. Fever and illness. In rare cases, fever or infection can trigger hallucinations, especially if the illness causes delirium or dehydration. Infections affecting the brain, such as encephalitis or meningitis, may lead to waking hallucinations, as well as confusion and other cognitive symptoms. 10. Sensory deprivation. Periods of sensory deprivation, such as being in a dark room for an extended period or experiencing isolation, can also lead to hallucinations upon waking. The brain may compensate for the lack of external stimuli by creating its own sensations, leading to visual, auditory, or tactile hallucinations. Conclusion: waking hallucinations, especially hypnopompic hallucinations, can be unsettling but are typically not dangerous. They are often linked to disruptions in sleep patterns, stress, or certain medications. In most cases, improving sleep hygiene and managing stress can reduce the occurrence of these hallucinations. However, if they become frequent or severe, it is important to consult a healthcare professional to rule out any underlying sleep disorders or other medical conditions.